Sarcoidosis is a very interesting disease state. Let's break it down. Granulomas are just collections of white blood cells. Remember, white blood cells, that's the body's defense mechanism, supposed to fight anything that's not supposed to be there. These white blood cells come together and they are fighting something, but we don't know exactly what that something is, which is the unknown etiology, meaning we don't know what causes sarcoidosis. What you'll start to see are these little shadows or nodules that we see in the lung that's associated with the sarcoidosis. 90% of the time, this disease will affect the lungs, which is why you often end up with someone like me, a lung doctor. The classical symptoms can include shortness of breath, chest tightness, wheezing, and cough. That cough can be a dry cough or it can be productive of mucus. But other symptoms that can include blurry vision, changes in the eyes, changes in the skin is something that we see very commonly here. And if, for example, it impacts your heart, the most common symptom you will see is palpitations, where the heart feels as though it's racing.
You ready? Let's go.
The diagnosis is multifactorial, and what I mean by that is we look at both the clinical scenario, the x-rays, and then ultimately a biopsy. So what's the clinical scenario? Sarcoidosis typically affects young people, usually between the ages of 20 and 50. And then there's the radiographic part, meaning what do the x-rays look like? Typically, we can see anything from just enlarged lymph nodes in the lungs to scar tissue or shadows, what we call infiltrates in the lung. And then finally, the way you confirm the diagnosis is you often have to have a biopsy. And that biopsy under the microscope will show those granulomas that we were describing, that collection of white blood cells that's causing inflammation. So here's the good news when it comes to sarcoidosis. 2/3, 66% of patients with sarcoidosis never require treatment. So the overwhelming majority of people never require treatment. Why? Because the body is able to control the inflammatory process.
Hey, Dr. Jackson.
Yes, ma'am.
I have this patient. He's got...
However, about 1/3 of patients, depending on the impact the disease is having on them, will require treatment. And we typically divide that into two categories: steroids and so-called steroid-sparing agents. Steroids, things like prednisone, methylprednisolone, dexamethasone, decadron, those are the only FDA-approved medications, along with a different medication that will help your adrenal gland actually make your body's own steroids, are the only two FDA-approved medications. The list of other therapies that we use, typically those that fall into the so-called steroid-sparing agent category, those are all off-label, but have been studied extensively and have been shown to be very helpful. Your physician, depending on how much your body has been impacted, more specifically, is one of your organs being damaged by the disease, will then make a determination in terms of whether or not you actually need treatment.
What are some of the ones that you might consider for him, and how might you approach his care?
Because sarcoidosis is a multi-systemic disorder, meaning many organs can be involved, it takes a village to approach and treat something like this. So what our center offers to patients is the ability to not only get state-of-the-art, creme de la creme, best of care that's currently being provided across the globe. But in addition to that, we have a network of physicians that we're able to refer you to if other organs are involved that may require expertise in those respective areas. Then there is the supportive care networks, being able to get you involved in support groups, which is also very helpful for those individuals, because there's a lot of things that happen with sarcoidosis that are beyond just the medical things that we see day to day. So when I take patients with sarcoidosis, what I try to tell them is, yes, you do have a disease that I don't know what caused it, but here's what we offer. And so part of that offer is certainly the medical part of things, but then there's also the hope and the goal of improving their day-to-day life.